Northern Kane County, Bartlett, Algonquin Lake in the Hills, and Cary Grove. Our chambers are advocates for the business community, and we regularly provide relevant, innovative, and impactful programming for you, including today's vaccination update for business. Before I introduce today's presenters, just a few notes. We will be recording this, so please do mute your microphones during the presentation. We only have about 30 minutes, so we will try and get to any questions at the end of this. If you have questions, please put them in the chat box in the bottom of your screen. It is my pleasure today to introduce our guests from the Kane County Health Department. Interim Director Kathy Foster, Assistant Director of Community Health Michael Isaacson, and Dr. Uche Nwada, who's the Director of Health Protection at the Kane County Health Department. Thanks to all the three of you for sharing your expertise and your knowledge here today, Michael. We've talked with you many times as we've gone through all of this, and you all are quite busy, and we are most appreciative of you taking a little bit of time from your schedules to talk with our business community today. So we'll now turn it over to you.
Great, thank you so much, Carol. We really appreciate the opportunity to speak with the business community. We know this has been an extremely tough year for businesses, for schools, for social service organizations. So we're really excited to be able to provide some positive news about things moving forward with the vaccine plan. So as you mentioned, I am joined by some of my colleagues here at the health department. We do have a great team. If you have questions, and we do want to leave time for questions so we can get some input from all of you, I'm certain that we have the right expertise among our team members to be able to get you a response. So I just want to start with a little bit of where we are right now with COVID in the community. So I'm going to show 3 sets of data points that I frequently share that are related to how the state determines the level of mitigation that a particular community is going to be under. So we have good news on Monday that in the Kane-DuPage region, which the state refers to as Region 8, we were able to move forward and get to what they call Tier 1 mitigation. So it's phase 4, Tier 1, and now we're able to open some indoor dining with limited capacity, which is fantastic to officially open it. We're able to host some social events. So there's some great things that we can get commerce moving even more to get people back to work. But the data that's on the screen is what the state looks at on a daily basis to make those determinations. On the left, you can see test positivity. So that means out of every 100 tests that we do for COVID in our community, what percentage are coming back positive? Here I'm sharing a 30-day view, so you can see that we did have some increases at the end of December, but over the past couple of weeks, it's come down. Our goal was to be under 8%, and we did meet that. So that's one way that we were able to move to a better tier, to Tier 1. So that's good that test positivity is coming down, and we are doing a tremendous amount of testing. So those two things together are very positive. We're testing a lot of people, and fewer of those tests are coming back positive. Over on the right-hand side of the screen, you can see the second measure that the state uses, and that is staffed hospital bed availability. So we always like to maintain at least 20% capacity in our hospitals. And you can see for the past month, we've consistently had that capacity. Again, this is regional data for the Kane-DuPage region. The third and final area that they look at to determine whether or not we need additional mitigation is hospitalizations. So here you can see over the past 30 days, we've had 25 days where we've had either a reduction or stable number of people in the hospitals. So this also is very good news. We had a few days last week, 4 days in a row, where we had slight increases across the region in hospitalizations, but overall, we're seeing a nice decrease in hospitalizations across our area. I always, unfortunately, have to bring another caveat up, though, which is deaths. So this chart is showing deaths from the summer to the present. This is data only for Kane County, so this is not regional data. This is Kane County specific data. This is updated on a weekly basis. And unfortunately, even with the good news of fewer tests coming back positive and fewer people being in the hospital, you can see that this trend overall since October, when we had that big spike in cases, has still been going up. So the last data point here, we were down just over 20 deaths for the week. And unfortunately, we're seeing this across age groups as well. So in the recent weeks, we've seen more people in their 40s and 50s who are succumbing to COVID. So there's a lot of really great news. The vaccine that I'll talk about in a moment is fantastic news, but this is still a very serious situation, and we really need to implore that everyone still follows guidelines and maintains as much social distance as they can, wears their face coverings. That's something you're going to hear me say multiple times in our short period together today. So what does it mean when we move to tier 1 mitigation? And I can send these slides out and include links to the state website. But just in brief, the indoor dining is officially allowed now. So that is limited to the lesser of 25 guests or 25%. We can see organized group recreation. There's some additional opportunities that are going to open up. And then finally, and I think this helps for a lot of us, meetings and social events, we can get together in groups of up to 25, depending on the size of the room. So for fundraisers, for just getting together and being able to socialize, again, hopefully in a way where we're using the appropriate face coverings and doing social distancing, but nice to be able to offer those opportunities to the public again. Also, you may have seen this week that we're going to start high school sports up again. So that's an area where we want to be cautious. But with all of these areas, whether we're talking about dining or getting together in social events, we know there's a huge economic impact when we aren't allowed to do these things. And we know there's a psychological impact. So even though we're urging people to be cautious, we're really thrilled that people are going to be able to socialize a little more. Sports are very important for young people and for adults to engage in. So again, lots of positive things as we're moving in the right direction. We always like to make the point to say, this is not a surprise to us that we had a pandemic. We didn't know when it was going to occur, but we've been planning for these types of things for a long time. I was on the state's pandemic planning team in 2002. We built all of these plans out. We know through history that this does happen. It is going to happen again, where there's going to be a large pandemic like this, hopefully not in our lifetime, but it is going to happen again. We can be assured of that. So just like to point out that at the county level, not only the health department, but the sheriff's department, all of county government, our transportation folks, we've all worked together with local municipalities. We have practiced these plans. We have set up clinics to practice handing out either antibiotics or vaccines. We're ready for terrorist events. We're ready for flu. We're ready for all of this. So in this case, we just like people to be assured that there is a plan and we are implementing our plan. In the upper left-hand corner, you can see what the cover of the state's COVID plan looks like. So this is something that's being updated fairly regularly. And there's important information in this because it provides us not only with the current information about the vaccines that are available, but it also provides us information about who's being prioritized to get the vaccine, which is something I'll spend a little more time on here in a moment. So we do have plans in place. Right now, our limiting factor is really how much vaccine we have here in our community. So I always like to show this slide. This is something from the Advisory Committee on Immunization Practices. The key points that we like to point to here, we are going to be doing this for months. So this is not a case where you call us and you get your vaccine and all of your employees get their vaccine next week. There are 530,000 people in Kane County. We're getting on average about 8,000 doses of vaccine per week. And currently with the vaccines that we're using, there's 2 vaccines that have been approved for emergency use. The Moderna vaccine and the Pfizer vaccine, they are both 2-dose vaccines. So for every shipment that we get, we have to think in our minds that we're not able to actually get somebody fully immunized with that, just half immunized. And then depending on the vaccine, either 21 or 28 days later, we're going to give them a second shot. We're not holding vaccine back. Every time we get vaccine in, we're pushing it out to the community, or we're setting up clinics ourselves and we're administering that vaccine. So you may hear a lot on the news about people worrying about vaccine being held in storage. We're not sitting on our vaccine. We're getting it out the door as quickly as we possibly can when we get a delivery. Another thing we like to point out on this slide is that the phases or the tiers are going to overlap. So the governor announced on Monday that as a state, we're moving into this tier 1B, but that doesn't mean we've taken care of everybody in tier 1A yet. So there's always going to be some overlap when we're working with different groups. Sometimes it's because we haven't identified everybody in a tier that needs the vaccine. Other times it may be because people weren't quite ready, hadn't made the decision that they wanted to get the vaccine yet. So we're going to be pushing more education and information out to try to encourage people to get the vaccine. Just a few pictures. On December 16th was really an exciting day here in Kane County, because that is when we first had our first shipment of vaccine. So this is, you know, the pictures maybe aren't that exciting, but it represents something that's really exciting, because finally, after all of these months of toiling and dealing with shutdowns, we finally have the tool that's going to help protect us to get us through this pandemic so that we can move on. Here's a look, and this is the Pfizer vaccine. You may hear about some of the storage requirements. There's a lot of logistics that go into the vaccines because they are very sensitive to temperature. The Pfizer vaccine needs to be held at the ultra cold storage. So that means health departments and hospitals around the country have had to order additional equipment in many cases. When we're transporting it, there's a lot that we need to do, and every pack has a temperature data logger where we need to maintain and verify that that vaccine is being held at the right temperature so we can assure that it's going to be effective. So just a shot of that. Now, a little bit about who's in the different priority groups. Phase 1A, I like to think of as really two different groups. One is healthcare, and that's hospital-based and community-based. And the second group is our long-term care facilities. So a quick word about how these priorities were made. At the national level, there's been a lot of discussion, and there's really two key areas that they look at. One, who is most likely to have serious illness and or death as a result of contracting COVID? And in that case, it's unfortunately, it's been our older population. As you all know, it's been our long-term care facilities where we've seen a large number of the deaths in our community. So that's why that group has been prioritized. A second area that they look at is, as part of someone's job, are we asking them to be in a position where they're more likely to be exposed to COVID? And they're doing some work that's essential, so we need to keep them on the job. So this may be people who are younger and healthier, which still none of us are completely immune from serious illness or death. But if you're younger and healthier, you have a much higher chance of not having serious illness. But if we can cut down on the spread of illness, that will also help the older population as well. So we can protect the older population from getting the serious illness, but by protecting our essential workers who are more likely to be in a place where they're exposed to the virus, that also is going to quickly, hopefully, cut down on the transmission. So you can see here in the hospital settings, all the different types of roles that we've been working to vaccinate. You can see in the non-hospital setting, all the different roles. And then a quick note on the long-term care facilities. We in Kane County, as well as around the state, are part of a national program where we have partnered with CVS and Walgreens pharmacies, and they're going on site to long-term care facilities to actually deliver the vaccine and administer it to staff and residents. As of last week, we had about 5,000 of our long-term care facility residents and employees who had been vaccinated, and that's going to continue week after week. They started with the skilled nursing facilities and are moving, kind of stepping down from there. So that's going to be something over the next month or so that will continue with those pharmacies. So that's excellent that those people are getting their vaccines quickly. What you may be more interested in is where we're moving into now is phase 1B. So this is where we are looking at a much broader group, again, defined by people who may be at higher risk. So in Illinois, we're looking at everyone over the age of 65, because we think that's where you're going to have more likelihood of potentially getting serious illness. I always like to point out that there are over 75,000 people who live in Kane County that are 65 or over. So again, when I'm talking about us getting about 8,000 doses of vaccine per week and needing 2 doses for every person to protect them, you don't have to be a math genius to figure out that at the current rate of vaccine delivery, that's going to take a long time just for the senior population. So we're hopeful that vaccine delivery is going to continue to speed up. But right now, I think that is a message that we really want to get out to everyone, is this is going to take time. There is not vaccine in Kane County or in Illinois or in the United States for everyone right now. I think it's pretty miraculous that we have a vaccine a year after this virus shows up in America, and we're already out there vaccinating millions of people is really exciting. So a lot of what we see on the news is negative about vaccine shortages and logistics issues and how many doses do we have? And those are all great questions. And I think we need to keep asking those and hold not only the federal and the state, but also the local governments accountable for being efficient with this. But it's pretty fantastic that this resource is available and is becoming more and more available in our communities. So continuing with the group, in addition to the 65 and over, we have all of our first responders who for the past year, we've asked them to go out and answer calls, transport people who are ill with COVID. The police officers are interacting with people who may have COVID. So this is great to get these groups of essential workers taken care of. We're looking at our education sector. So that's the way they've currently defined it is childcare and pre-K through 12th grade. So certainly our teachers are exposed to a lot of kids. We want that to be a safe environment. So that's good for all of us, not only families who are struggling with the remote learning, better to get kids back so they can socialize and interact and learn in the classroom. The entire food and agriculture sector, the entire manufacturing sector, corrections workers and inmates. And we get a lot of pushback on this because people say, well, why would an inmate get a vaccine before I do? And for people in jail, just a reminder, they have not actually been convicted of a crime yet. But even if people are in prison, they're more than 5 times as likely to contract COVID just because they're in that congregate setting. So it is a very high risk area for people. So they're in this large group. The United States postal workers, public transit workers, grocery store workers that we've asked to still be on the front lines this entire time, making food available for us. And then just like with the jails, other congregate settings where people may be. There was some information that just came out last weekend where for home care providers, for families who have children with special needs, they are now being included as healthcare workers. So that was new information that's just come available to us. So we're working on that to make sure that we can work with all those families to assure that they're fully protected as well. So this is a big group. This represents well over 1/3 of the residents of Kane County who are eligible for vaccine. And so it is going to take us some time to work through all these people. So what can we expect? To date, Kane County has received just over 43,000 doses of vaccine since December 16th. We are very hopeful that we're going to see more and more vaccine coming available. We are working with individual providers in the community to get vaccine out. So we're working with pharmacies, we're working with physicians' offices, we're working with clinics, and we're setting up our own clinics through the county to make sure we can get vaccine out to people. We have a sign up where people can go to get a weekly update on where vaccine is going to be available. Again, we want to temper this. We're giving the information about where people can sign up, but there's not enough vaccine yet. So we are hearing from people that when we weren't giving that information, and I completely understand it, people were feeling anxious because they didn't know where they could go to register. Now we're putting that information out so you can see the different pharmacies and start to see where the different medical offices are. However, I just want to be crystal clear, there's not enough vaccine yet. So you can count how many times I'm going to say that. So people are going to these sites and are frustrated because there's not enough vaccine, which again, I understand, but we're making available to people where they are going to be able to get vaccine. And then next week, there's going to be more vaccine. The week after that, there's going to be more vaccine. So we are very, very hopeful that this is just going to continue to get better. Our website, and I know Susan Stack, our communications director, is on the line. We have a lot of information there about COVID. I know we've worked with a lot of your organizations over the past year, and not only in outbreaks, but also in prevention. So I encourage you to keep an eye on that kanehealth.com. There's a lot of good information there. So not only is there information where you can sign up to get the vaccine information, but there's a lot of additional educational information that I think is helpful for businesses. And then we are continuing to have ongoing discussions with specific populations. And I think this is where it's going to be of interest to many of our larger employers. So right now, we don't have enough vaccine to go and make arrangements to do on-site clinics at your facility. 2 weeks from now, we might. 3 weeks from now, we might. We're taking a conservative approach where we don't want to overpromise. So we're not scheduling clinics unless we're assured that we have the vaccine, because we feel that it's even worse to give people the hope that they have a vaccine, say on February 12th, and then you stop looking other places for that vaccine because we've told you that we will give it to you. We want to be able to be honest, and we want to honor our commitments. So when we start to get more vaccine in Kane County, that's when we're going to be able to work with our medical providers and work with your medical providers if you have on-site occupational health, where then we can talk about how we can set up clinics potentially for your employees on site, or we can work with providers, especially if you're one of the essential services, where we may be able to get specific opportunities where your staff can go and participate in clinics. So again, if they're over 65, or if you're in these criterias, people are certainly welcome to identify their own opportunities. I'm not asking anybody to wait, but as we get more vaccine, we do want to work with the business community to make sure that we are taking care of you. I mentioned that we're working with a number of providers. Currently, there are about 40 providers. I think we're up to about 45 providers that the state has approved, locations where the state has approved they can administer vaccine. So we're not getting enough vaccine right now to give it to all of those providers. But again, as vaccine starts to come in more, we're going to be able to spread it to even more providers in the community, and so that they can make it more available. So hopefully people will be able to go to their private doctor, their pharmacy, the clinic that's right down the street from them, and we can make this as convenient for our residents as possible. And then finally, something that's going to logistically make things much easier and much quicker to get vaccine out into people's arms is the state will be able to start direct shipping. So just today, we're starting to put in orders where we're direct shipping to hospitals rather than it coming to us. And, you know, I showed the picture, we're having to do all the temperature data logging, all the transfer paperwork, all of that kind of thing. Now we can just order it from the state and send it straight to the hospitals, straight to the pharmacy, straight to some of our other providers. So they get it more quickly. It frees our resources up to be able to serve the public in better ways by us running our own clinics. So we're very optimistic about the next few weeks, but right now it is going to start slow. So that's the truth of it. And then a final note I want to highlight is that even if someone's vaccinated, these vaccines are new. And so the purpose of the vaccine is to protect you from serious illness. I haven't been vaccinated yet. If you see me, I'm usually sitting in this office. So I'm not in a high risk job. I'm not out interacting with the public. I'm talking on Zoom most of the time. So I haven't had a shot yet. But if I was fully immunized, I still may be able to get the virus and pass it to someone else. So that's something we'd like to remind people of, is even if you're fully vaccinated, it's not a get out of jail card to go and start going to all the parties and interacting with everybody. You would be protected, but you still may be able to pass the virus to other people. Now, we're being conservative by saying that. We hope that as we continue to get more data, that we will see, just like with most vaccines, that these vaccines are offering a tremendous amount of protection and are cutting down on a lot of transmission from person to person. But right now, what was really studied when these vaccines got their emergency use authorization was, do they protect the individual? So we just want to be cautious. Again, I'm optimistic that it's going to cut down on transmission, but we don't like to overextend the data that we have in place. So we always like to leave with again, just encouraging people to wear a face covering if they can't be socially distanced, and try to social distance as much as is allowable. And with that, I will open it up for, I'll stop sharing my screen and open it up for questions.
So Michael, we've had a number of questions that have come across
Great.
the chat box. One of those relies on the masking and the question about double masking relative to the new strains of the virus that are coming through. Could you or someone cite their opinion on what we should be doing?
Absolutely. So this, as we are monitoring the strains around the country and around the world, there is starting to be more discussion about double masking. It's currently not a recommendation. And I'm just looking to make sure if Uche Onwuda is on the call or not. Uche, are you on? Okay, perhaps she wasn't able to join us. But the double masking is currently not a recommendation. So the concern is that some of these new strains may be more easy to transmit, but it's currently not a recommendation. One thing, and I was watching the news last night, and the new director of the CDC and Dr. Fauci were speaking, and they were saying, we want people to wear masks. So, you know, my undergrad degree is in nutrition, and there's a lot of talk about organic produce. Organic produce, you can make the argument that it's better. Most people don't eat enough fruits and vegetables. So it's the same kind of thing with the masks. We want everybody to wear a mask. Too many people aren't wearing masks at all. So we'd like them to wear a face covering. Any kind is good. There's talk about is cloth enough, or should we double up? Any kind of mask is offering some protection to stop those droplets. So whatever people can access, we appreciate.
And Michael, what about the county? I work in Kane County, I live in Lake County, I work in DuPage, I live in McHenry. Can you address that, as many employers here have a wide variety of locations where their staff is from?
Absolutely, and that's something we have a lot of discussion about. So my take on this is that we are all in this together. The vaccine is a federal asset that is being delivered to the states and passed down to us. So on one hand, our allocation in Kane County is based on our population. So we don't want busloads of people, no offense to Wisconsin, we don't want busloads of people coming down to our clinics and taking all our vaccine. But that being said, we appreciate that people live and work and seek their medical care across county lines. So at our clinics, when we work with people, if you work in Kane County, if you live in Kane County, if you get your medical care in Kane County, that's who we really want to prioritize. That's who we want to encourage to attend our clinics. Again, we don't want busloads of people coming from different places to soak up all of our supply. But eventually we do want everyone in America to be vaccinated. So speed is what we're really looking for. So we're trying to move people through the lines as quickly as possible. And we're in close communication with our other partner organizations around the Chicago region. And I know people feel the same way.
As far as the vaccines that are coming in, Michael, we've got 1 minute left in our presentation today. Are they coming from all the vendors who are supplying vaccines?
Yeah, so we have the Pfizer and the Moderna right now. We're looking forward to the Johnson & Johnson getting emergency use authorization very soon. That's going to be a 1-dose vaccine, which cuts the work in half. So that's fantastic. So we're looking forward to that and other vaccines in the future.
All right, and so you aren't sitting down in your office with Kathy and Susan and Dr. Onwuda determining who's going to get a vaccination over who's not going to get a vaccination. Is that correct? There are predetermined levels of folks in 1A, 1B who should be getting those. Is there any flexibility in those levels with the Kane County Health Department?
Well, we're really working with our provider organization. So as I mentioned on the one slide, we're looking at where we see risk. So if there's a facility where we think people are more at risk and we have evidence that there's been illness, we want to make sure that we're protecting those most vulnerable people. In other cases, we're looking at where we have groups already together. So for our law enforcement, it's easy for us to set up a clinic and run all the law enforcement through so they can get back and be on the job. But as we move forward, the 1B group is a big group and it's not sub-prioritized. It's just everybody's in there together.
The Kane County website, will that ultimately be showing us the numbers of vaccinations that have been done? What still might be available? We can make an appointment on that website. That really is the clearinghouse in which we would recommend everyone pay attention to and sign up for your newsletter, informational newsletters, if nothing else, right?
Absolutely. Yes.
Okay, good. Well, we've reached the time at 12:01 on my clock, and so we have to unfortunately conclude this. Perhaps there's another time that we'll be able to convince Michael and his team to come back and talk with the business community. They've been exceptional with the work that they've been conducting through this difficult time. Again, to the Kane County Health Department, we appreciate all that they've been able to do. And to my colleagues and the chambers of commerce up and down the Fox River Valley, thank you very much for our opportunities to work together and provide this kind of information. Do pay attention to our calendars, see what's upcoming, and we'll see if we can't get another update for the business community relative to vaccinations. Meanwhile, please do go to Kane County Health Department for more information, or to each of your own health departments in the communities in which you might live or work. Thank you everyone for joining us today. We wish you well, stay well. Thank you again.